Hi, I'm Dr. Seiler from Seiler Skin in Birmingham, and we're going to shoot a video here of the liquid facelift with Voluma to help this patient's cheeks and all around her mouth area. You're going to see me do a little numbing shot. Makes this virtually painless, this treatment. And we're going to do a little Botox around her eyes, and then we'll have several clips of putting Voluma kind of all over her face to give her a nice lift. So this is her first time having this done. She's had Botox before, but this is her first time with Voluma. So first we're going to do this little numbing shot. She's had a little numbing shot before, so you'll see that this is easy to get through. A little poke. I kind of wiggle a little bit to distract you from it. Is that okay? Mm-hmm. You'll feel this get numb really quickly. Make you feel like you've got concrete in there, but it makes you completely numb for the treatment. Mm-hmm. She's watched some of our other videos which helped her come in for this treatment, so let's do it. We'll make a good numb there. Switch to this side. You feel that kicking in pretty quickly? Mm-hmm. This is just to show how easy this little numbing shot is to get through. A lot of patients, if they've had this done before, it's somewhere else, have complained about having discomfort with this treatment, and you'll see that this is pretty easy to get through if I do this little numbing shot. Mm-hmm. Alright, good. So we'll let that kind of get started there. I'm going to do a little Botox around her eyes, so squint real hard for me. Alright, relax now. So you can see that she kind of moves this little area pretty good to make the little radiating line, so we'll stick. We'll do 3 little shots of Botox around here. Is that okay? Mm-hmm. And if you take your time with this and hold pressure, patients don't bruise and they don't really feel much, so. Alright, the nurse is going to hold a little pressure there while we switch to the other side. So far so good?
Yes.
Turn away from me just a little bit. Botox will help to keep her from squinting so that she doesn't make the little lines around the eyes. This also helps to kind of open up the eye a little bit too, to give them a nice little eyebrow raise. We'll stick. Okay, come on, hold that for me. Alright, so that's it for the Botox. I'm going to do the Voluma in the cheeks. This is the first step, is to give her a lift. You can see that she's got a good cheek here. Her cheeks haven't really fallen that much, but you can see that just a little bit of lifting in this area will really significantly help with the mouth down here. So what we actually do with this is a little bit deeper of an injection to give her a good base here, a little stick. And she'll feel just a little bitty poke, but it shouldn't be much more than that. Is that okay? Mm-hmm. So this is just a series of small little injections with the Voluma. And it's really amazing what just a little bit of Voluma will do. I was actually the first in Birmingham to start using this when it came out last year. Of course, Canada's had it for about 5 or 6 years, so there's a lot of good long-term studies on it. And we've gotten really, really good results. Sometimes even just one syringe split up between both cheeks is enough for people to see a nice difference. And Voluma lasts a lot longer too, so Voluma will last about 2 to 3 years. And you've got some great eyelashes.
I use Latisse.
Yeah, there you go. Latisse is a wonder drug.
Mm-hmm. If you have brown eyes.
Yeah. A lot of women are using it on their eyebrows.
Oh, really?
Yeah. A lot of, it's not, technically it's not on label. So we have to tell people that if you're going to use it on your eyebrows, that it's not something that's been studied yet, but everybody does it. So we're going to do about half a syringe on each side, and you can see that she's really not bleeding at all from this, so she really shouldn't bruise. I always take my time so that if they do bleed a little bit, we make sure that they don't have any sign of bleeding before they go, and that's what really makes a big difference to reduce the risk of bruising. If you do this injection too quick, And not only does it hurt, but it also makes the patient more at risk for bruising. And you really should not bruise with this procedure if it's done correctly. So for any of those of you watching, if you've had something like this done before and you had a lot of pain or bruising with it, that really shouldn't be the case. So okay, so now we've put half a syringe of Voluma in her right side of her cheek, and she really didn't bleed at all. She said it was virtually painless. So lean forward for the camera now, and you can see, it might be kind of hard to pick it up on the camera, but now you can see that this cheek is fuller, and she's already got a little bit more lifting on that side. So Catherine, my nurse, has got the other side iced real good, so we're going to switch to that side. Okay, lean back for me.
Okay.
Come switch with me and hold that. We always hold a lot of pressure, even if they're not bleeding, just to make sure they don't bleed. Alright, so now we're going to do the same thing here. Icing really helps not only minimize the risk of bruising, but also the discomfort. It's normal for you to feel just a little bitty stick with this, but it shouldn't be bad. Might be a little difficult to pick it up on the camera, but you can instantly see the lifting from this when we do it. It's pretty cool. I was actually impressed myself with how much volume you really do get from Voluma.
When you think about how little...
Well, yeah, right. And when you think about how little you have to
injecting.
put in, we're just putting in little bits at a time here. This basically kind of works by putting the skin almost kind of up on stilts, if you think about it that way. Instead of having to put a whole bunch of filler in to... People are always worried about, is their face going to look wide or fat, and that if it's done correctly, you won't look that way at all. And then after this, we're going to focus on the lower face, and we'll do around the mouth. I'll give her a nice lift. You can see that she's not bleeding at all from this. She's really not. She's doing fine. Alright, so we'll clip off right there, and then we'll come back and we'll do the rest of the lower face. We've completed the Voluma injections of her cheeks. As you can see, we're holding a little pressure just to make sure she doesn't bruise or swell at all. So now we've got her good and iced right here. So now we're going to do a series of injections here to help lift the lower part of the cheek. And from the Numbing Shot, she ought to be completely numb for this. You feeling anything? Usually you feel just a little bit when I do the outer part of the cheek, but not bad. But this is completely numb. This is really going to help just to kind of rejuvenate her entire, what we call the perioral area, which is all around her mouth, above and below. You can see that she's not bleeding at all, so she really shouldn't have any bruising from this. I always take my time and make sure we hold pressure, but sometimes patients just tend to bruise a little bit, but she's really not. She's not having any problem with it at all. So we're going to ice down here just a little bit. Got the ice, good. And this really helps to kind of keep the corner of the mouth from turning down. A lot of people will lose a little bit of volume and the lower face starts to kind of show a little bit of laxity, and so we can really rejuvenate this part right here. You will feel just a little bitty stick. Shouldn't be bad. Is that okay? This way this will really give some nice volume to all this area down here. This is part of the whole facial lifting process right here. It's really to give her a nice line to her jaw.
Will you explain what's in Juvederm?
Yeah, so Juvederm is hyaluronic acid, which is actually made by the skin. So the skin actually makes hyaluronic acid as its fluid moisturizer, but it's made very thinly by the skin, so it's got a cellular turnover of only about 3 to 5 days. So Allergan, that makes Botox and Juvederm, also makes Juvederm VOLUMA, and it's just made by the company to be much thicker in a gel, so it lasts a lot longer. It doesn't get metabolized as quickly. The beauty of it is that since it is something that's naturally occurring in the skin also makes an enzyme that will metabolize it and break it down, and that enzyme is available by injection. So if anything happens and the patient doesn't like it, it's completely reversible. I've never had to use it on my own patient. I've used it on patients that have come from other practices, and if they've had it put in the wrong place, I can inject them with that little enzyme, and it literally metabolizes it within a matter of a couple of days. So it's basically a completely reversible injection. So it's a very, very safe product. Voluma is, although considered new, we call it Juvederm's bigger brother. It's the same basic makeup as Juvederm has been, it's just thicker. And Voluma came out last year, but like I said earlier in the video, it's been studied for years now, and it's really doing a good job for us. So we'll finish off this side of the face here, and then we'll do the rest. And she's given us permission to not only obviously show this video, but also her before and after pictures, so her pictures will eventually be on our website. Alright, so we're almost done. We're going to finish up the lower part of the mouth. Let's ice a little bit right there. You can see that if the camera picks it up, you can see she's not really bruising anywhere. She's got one little spot over here that might be a little point, but that's it. So she really shouldn't see anything at all with makeup on. You'll be able to get in real close here and see. I do a little wiggle to kind of help take your mind off of the little shot, and that way you barely even feel it. We call that the Seiler wiggle. We try to make this fun.
Mm-hmm.
This should not be an unpleasant experience. This should be a good experience for patients. So.
It has not hurt, and it's not unpleasant.
Good. And I trust that you would tell us if it did. So.
Oh yeah, I would.
A little bit right here. Alright, so we're going to finish up the face, and we'll see the pictures online here in just a little bit. So thanks for watching.
I'd just like to say that I've had Juvederm and Botox done several times in the past, and this is a completely different experience. I had no pain, so gentle, just a completely different, it was a pleasant experience. Did not hurt at all. I'm so glad I came here.
Thank you.